why do I have to do what they're doing? And this person described a kind of hollowing out of the VA at the leadership position. And I think this is an actual Trump policy in all of the federal government. You put incompetent people in, you put nobody in, or you don't have effective leaders, and then people don't trust government anymore. One of the examples of this that we talk about in the report is Kayla Williams, who was the executive director of, or the director of the Center for Women's Veterans. Kayla is almost a poster child for women veterans. I mean, she served in Iraq. She's extremely articulate. She's written 2 books. She's a very effective communicator. And she was essentially pushed out after accomplishing an enormous amount by the Trump administration and lack of support. We also talk in the report about punitive management practices at the local level, specifically in several regions where either managers who don't have a lot of experience or who institute very punitive practices that have driven psychologists and psychiatrists out, social workers out, nurses out. And we've heard this in a lot of places from around the country. And I think this reflects the kind of attitude that Congress, the administration, and the media have toward the VA and VA workers, which I think Jasper is going to talk about now.
Yeah, sure. I mean, I think that in our work researching this vacancy crisis and trying to understand it, there are sort of 2 eras. There's like the era of negligence as the wars in Iraq were ramping up and the administrations, both Bush and Obama, just simply did not do enough. Congress did not do enough to build up the VA to deal with this huge influx of veterans. And then there's an era of hostility, which sort of began during the tail end of the Obama administration in Congress and has really been embraced by the Trump administration. So I suppose it's worth focusing on negligence just because we have, hostility because we have limited time, and that's sort of what's really exacerbated the crisis. A lot of these issues really popped up in 2014. As many of you know, that's when there was this scandal at a VA hospital in Phoenix. Administrators were essentially juicing the books and obscuring the actual wait times for veterans in care. This resulted in a huge scandal that many conservatives seized on as evidence that Obama, hated veterans, was a poor administrator, and essentially needed to be, and that the party needed to pay for it. Out of that scandal came the VA Choice Act, which was negotiated between Bernie Sanders, who was then Senate Veterans Affairs chairman, John McCain, his counterpart in the Senate, as well as the Republican-controlled House and the chairman of the House Veterans Affairs Committee, Jeff Miller. Suzanne and I go pretty deep in the report about how this all came to be, this final package, and I think we reveal some interesting new details about sort of why the final package was as flawed as it was. I mean, Bernie did fight hard and got some good money to hire more people. He had been ringing alarm bells for years saying the VA needs not only better benefits for returning vets, it needs more staff to deal with them. In addition to returning post 9/11 vets, the Obama administration had also opened up a number of conditions, sort of made them presumptive to Vietnam service. So more Vietnam veterans all of a sudden were also accessing the VA, which further strained the system. Out of choice came the privatization angle, which is where a lot of the money has gone. Someone in the comments said, VA is seeing these historic budgets. What's the deal? Why is the agency not able to hire the adequate number of people? It's largely because roughly a quarter of money for care now is going to the private sector. This is a result of the Choice Act, which allowed vets to go to the private sector under certain conditions. And then the Mission Act, which is sort of the Trump branded version of that, which is a permanent program that is much sort of broader in scope and is expected to see many more veterans and much more money going into private sector pockets. Trump made choice permanent, as I said, which starves the agency of money to hire and to invest in infrastructure, research, all of those sorts of things. But that's not all that he did. He also took a number of drastic measures to attack employees. The first being the VA Accountability and Whistleblower Protection Act. This also sort of, this idea of accountability emerged after Phoenix. The main administrator in Phoenix, who was blamed for this, was able to retain her job. And again, Republicans seized on this, that, you know, union power was too strong, workplace rights needed to be eroded. Bernie was able to beat that back in 2014, but once the Senate switched parties, once Trump came into office, they were able to institute this Accountability Act, which essentially established a shadowy office that has been just absolutely indicted by federal investigators from the Government Accountability Office, the Project on Government Oversight. It's basically seen as a tool to crack down on labor leaders at the local level, as well as sort of just low-level employees who may be struggling in their jobs or, you know, engaged in some sort of minor indiscretion. As this law was implemented, thousands of employees were terminated. So not only was there this huge growing number, this vacancy number, but the Trump administration through the Accountability Office was able to just push thousands more people out the door in a very short amount of time. The department used to post data publicly of all the firings, terminations, and suspensions. They've since stopped doing that because there was a lot of scrutiny on some of these cases. But this really was the first major sign of hostility. This came before Mission, and not only did it push people out the door, but it also sort of spread throughout the healthcare community, this sort of new attitude towards employees. And so Suzanne and I both spoke to people who knew people in the private sector or in the private sector who said, listen, you know, I want to join the VA. There are many benefits of being in the VA, but you know, I don't want to enter this department and be unfairly tarnished in the press. I don't want to be accused of something I didn't do and have no recourse. It really took away a major incentive to joining the VA, which is a healthy, good environment where you can feel a part of a team focused on care, you know, not have to deal with insurance companies. Like there still are many benefits to joining the VA, but this really sort of eroded those benefits. And so, in addition to that, Trump has also rolled out a number of executive orders that have taken away union time from folks, which makes it really impossible for sort of frontline demands issues to be remediated. This is very starkly clear during the coronavirus as folks are asking for more PPE. They're trying to get a sense of how different units are being shifted to COVID units. They're trying to ensure that the proper training is there. I think Linda's going to speak about this soon, but you know, sort of taken together, all of these attacks on employees have really made hiring a problem and sort of further have sort of exacerbated the brain drain, as well as just sort of the mass firing of employees.
Thanks, Jasper. And again, if anybody has any questions, feel free to throw them in the chat or raise your hand and we'll get you on screen to ask your question. But first, I want to introduce Linda Ward-Smith. Linda's been a VA nurse for over 10 years, or she's been a labor activist for over 10 years. She's been a VA nurse for over 15 years. Linda Ward-Smith is the president of AFGE Local 1224. She's been advocating for colleagues even before taking her official position in the union. Linda, thanks for being with us today. And if you could tell us a little bit about what you're seeing on the ground there, just first around COVID-19 and whether vacancy issues you have now on the floor or in the past are impacting that care.
Hi, everybody. Thanks for having me. Yeah, so with this COVID-19 pandemic, it was early on noticeable that the VA really wasn't prepared for this pandemic, this crisis. And I say that because early in the stages, they started pulling staff that I feel was not really well equipped to handle the type of patients that were coming into our facility or who might be coming. So, and it was mainly because for staffing. So in order for them to fulfill a bed surge plan that they were mandated to do, they had to start ramping up bed numbers and levels because of the anticipated fourth mission. And with that, they had to try to triple their capacity. So of course, in doing that, we didn't even have the staffing because we were at bare minimum staffing in the beginning. So that meant pulling unqualified, in my opinion, staff from the outpatient clinics to immediately try to fulfill a void. And so with that, of course, we had high anxiety with staff members because, half of them didn't even have experience in inpatient care, right? They're outpatient clinic nurses and technicians. So to be told you're going to be pulled to a COVID unit, taking care of high-risk patients, well, of course, they became very disturbed with that. So that was just one of the things. And so the training was very minimal. Some of them had high-risk medical preconditions that were kind of overlooked because management couldn't spare them to be away. They needed bodies, they needed staffing. And so I had members who were, high risk for being exposed. They are still trying to get accommodated either through telework or other means because they're afraid, and that's still happening today. We actually had parents of child care where the child, care facilities, the schools closed, and they were told you need to figure it out 1 to 2 days and you need to be back. And I think it's a direct relation to the fact that they needed bodies, they needed staffing, and so they couldn't accommodate different needs of individuals because they needed them here. We had people who were actually getting exposed and were not told. And so they actually would find out that they were exposed by the person that exposed them coming back to work. So those were issues that made, everybody anxiety really high because, they felt like they were not being protected. Reaching out to OSHA was kind of like a no deal because OSHA pretty much told me that their hands were tied. If they came in and did an inspection, that they would have to shut every hospital down. So that's what they told me. So we felt like we just had no oversight, no hope, no anything. We were all pretty much on our own. And still today, I would say that the agency is trying to work at resolving some of the issues, but VA nationwide, I believe, is just still struggling to try to get this thing right. So I'm thankful to have this opportunity to speak about the issues. And if you guys have any questions, please feel free to ask. Thank you.
So we've had a few folks pose questions about something that Secretary Wilkie's apparently said to the VSO community just in the last week. Sarah Edgerton of DAV and Renee Campos of the Military Officers Association of America are asking about, is it really taken place that what Wilkie has said, that there's been 9,000 new hires using an expedited hiring process here in the last 4 weeks? And why is it a priority now? Obviously with the pandemic, but why couldn't he have done this months ago when he told the Congressional Committee that it just wasn't a leadership priority for him to be filling these 50,000 vacancies?
Well, I think that's a very good question. And why is it a priority now? Because the vacancies have existed for a long period of time. We all know that. And yes, it is true that they have relaxed a lot of the, I guess, the red tape, so to speak, with hiring different, as you guys know, we have Title V, we have Title 38, we have wage grades. So we have a whole lot of different hiring authorities that sometimes make it very difficult from an HR perspective to bring employees on. So there was a memo or something that came out early on with this that relaxed those regulations. And so they have been hiring people here, at least in my facility. I've been seeing an uptick in hiring. So yes, that is happening. The 9,000 number, I cannot confirm or deny, but we have seen an increase in onboarding different new employees. So that is happening now.
And Suzanne and Jasper, this was one of your recommended solutions on how to solve the staffing crisis. It's the expedited hiring process. Can you talk a little bit about, why you think it's happening now, and can it stay over once the crisis is passed?
I mean, I think that Linda really hits a very important point. You never know when there's going to be an emergency, right? You don't know a virus doesn't come 6 months in advance and say, hey, I'm planning to, run through the global population in 6 months. So get your act together. You have to hire enough staff to anticipate problems. You have to have enough ventilators, you have to have enough PPE, and you have to be, as a nation and as a world, prepared to never use those, you may never use those nurses for a fourth mission or for a pandemic, but those nurses, those HR people, those medical staff officers, there's a lot for them to do. And basically, one of the huge problems that we look at in the report is that they don't have enough human resources people to do the recruiting and onboarding, not to mention enough money to do it. There's hiring freezes that they deny, or hiring freezes. There were, at the time that before the pandemic, there were hiring freezes at 14 out of 18 visits, we were told. People, they say there's enough money. I mean, this is one of the sort of things that we talk about a lot, is this big lie that there's enough money. Well, if you need $100 million and they give you 20 million more, yeah, they've given you 20. I mean, if you need 100 billion and they've given you 20 billion, or 80 billion and you need 100 billion, you can give the VA money, but it still may not be enough money. And as Jasper pointed out, the money that isn't enough money may be going to many of the wrong places. I think that one of the concerns that some people in the Veteran Service Organization community have is that the rapid hiring, which they are clearly doing more hiring. We can't confirm whether it's 9,000, but they are doing rapid hiring. One of the concerns will be, that they're not adequately vetting people. You can adequately vet people quickly if you have enough people to adequately vet them. And if you have to have more medical staff officers for clinical positions, and you have to have enough HR people. And they don't have that right now. You can't just be hiring more nurses, more doctors. You have to be hiring support people, administrative people, people who do billing and coding and answer phones, and people in the HR and medical staff offices.
I'd also just like to point out that there has been a crisis raging in the veteran community far before the coronavirus hit, and that's the suicide crisis. And, VA secretaries dating back to the W. Bush administration have made stemming the veteran suicide crisis their top priority. And yet, if you look at data going back years and you look at reports from the Office of Inspector General, the most severe vacancies are for mental health staff, psychologists and psychiatrists. And yes, there's a national shortage of these folks, and it can be difficult to bring them in, especially with certain limitations on pay and everything else. But if these leaders truly believe that the veteran suicide crisis needs to be addressed with every tool available, and that money is no object, then the department should be given the money and the resources to hire up in those critical positions.
Well, and they also shouldn't be pushing people out. I mean, two of the case studies that we give, Memphis and Northern California, we focus in on mental health professionals. One of the people who left in Northern California because of poor management was a suicide prevention coordinator who just left. They've lost over 20 people in Memphis. They've lost, I'm not sure if it's over 20 people in Northern California, psychologists, social workers, psychiatrists. We quote Kenneth Kaiser, who was perhaps the most Secretary for Health ever, at least in the last several decades. And I think it's worth reading in the report. And he says, if you want to recruit and retain staff, then you have to support them. And you have to, yes, there may be some bad apples or whatever, but you don't focus on the bad apples. You don't focus on how many people you fired. You focus on how many people you hired. And there has been a bipartisan consensus. This is the Democrats and the Republicans, and sometimes the veteran service organizations, that really have had very little good to say about VA staff, and have really been engaging, whether it's Jeff Miller in the House Veterans Affairs Committee in 2014 to 2016, or others. There is just this bad, negative, and it's hard to convey in a report the anguish of the people that have talked to Jasper and me, people who literally are in tears on the phone or in person. I have people, when I go into the VA, saying, why do they hate us? Dedicated people giving their lives to veterans, now potentially sacrificing their lives, and they say to me, why do they hate us? Why does the media hate us? Why does Congress hate us? And that just cannot continue.
And I want to just go over to Mark Foreman, who's a Vietnam veteran who is with us today. Mark, are you on the line? I've unmuted you. Mark?
Hear me?
Yep.
You
Go
can
ahead, Mark.
hear me?
Yep.
Okay,
So
thank you.
I'm a veteran who is out of and uses the Milwaukee VA. Mark, can you tell us a little bit about your concerns about why staffing is such a problem, and now that COVID-19 has hit and the VA is tasked with implementing its fourth mission, what does that mean to you as a veteran?
Well, it makes me angry. I mean, it's obvious the need in the VA hospitals to have enough staff to handle the need. I've been using the VA. I was in the Vietnam War and severely wounded back in 1968. So I've been going to the VA hospital for the last 52 years. And I've seen it evolve into a wonderful veteran culture within the VA hospitals. Because of the mental illness effect of post-traumatic stress, veterans come into the hospitals not only with severe physical wounds, but severe mental wounds. And if we don't have enough psychologists, trained psychologists, to handle this, then there's going to be a lot of veterans languishing. And so I'm really concerned about this Mission Act and how it's affecting veterans, the culture of veterans within hospitals. You don't get that at private hospitals. And so I'm just really concerned that the Mission Act is going to undermine what's been built up over the years, and now it's all being taken away. Hello? Oh,
thanks, Mark. I'd like to go over to Isam Atya. Isam, you are an Iraq War vet, right? And you actually just wrote a piece for the New York Independent, an op-ed talking about the staffing issues and some other issues. Could you talk a little bit about that?
Yeah, absolutely, Brett. Thank you so much for having me. Like Brett said, I'm an Iraq War veteran, and I served from 2003 to 2006. And I've been using the VA for my healthcare here in New York City ever since. And for the most part, even though the VA in New York City has never been one of the highest rated in the country, I've always actually really gotten great healthcare from the place. I've really enjoyed the process. I think the integration of all the healthcare systems within the VA is far better than what you experience outside of the VA. But I have noticed that since the Choice Act and the Mission Act were passed, that there have been definite changes to the way, the VA hospital functions. And the staffing shortages have become both visible and something that like affects your ability to get care. And I wrote about this in the op-ed, which I can send out a link to, but one of the main things that I noticed was one time I went in to see a doctor, and I actually was taken to the emergency room and then had to see a specialist, and that specialist wasn't able to see me for something like 45 days. And one of the stipulations of the Choice Act was that if you have to wait over 30 days, you're able to go see a private healthcare provider. And I was like, okay, cool. So let me take advantage of this program. But what they don't tell you is that you actually have to go to your primary care physician to get that referral to a private healthcare provider before you can go to the healthcare provider, and the VA will pay for it. So there's a fairly, the Choice Act made the bureaucracy actually more complicated to navigate for veterans as opposed to simpler. And in the end, after having seen that private healthcare provider, the VA refused to pay for that care for me, and I ended up out like $1,500. I think it's really important to also recognize not only that the integration of the care that veterans get at the VA is very good and valuable, and removes the sort of insane bureaucracy of the private healthcare system, but also that the service that the VA serves as a public institution is incredibly valuable. And there isn't enough conversation, I think, about the research and the education role that the VA plays in American healthcare system, which is also incredibly important. And with the staffing shortages, that means there are fewer doctors coming through rotation from NYU Medical School, getting trained, and that means there's obviously less of a budget going from a federal budget going to the VA for adequate research when it comes to amputee and mental health and everything, and all these other programs that the VA is very central in driving innovation in, and as a result, like the general welfare of the nation is going to suffer.
Thanks, Isam. And we're going to get to some questions now. Suzanne and Jasper, if you could talk a little bit about, and Linda, if you want to jump in as well, the risk that VA employees are currently being put in because of COVID-19. Over the last weekend, there had been kind of an uproar on Rachel Maddow and social media over the lack of data that the VA was putting out on how many veterans had been infected with COVID-19 and died, as well as employees. Jasper, Suzanne, can you talk about how that is being tracked? And Linda, if you want to jump in as well.
Well, I mean, this lack of preparedness is a society-wide problem. And, you know, we can't only blame the VA, and we can't only blame Trump. I mean, there's a long history of impacting the ability of the VA to get supplies. In 1991, I believe it was, under George H.W. Bush, they eliminated the depot system where the VA had warehouses with all these supplies and medical equipment. And then they were forced to go to this prime vendor system where they were dependent on the just-in-time practices of private corporations. Under Obama, there was very little emergency preparedness. They actually did away under Secretary Shulkin with the, oh my God, the HOC, the, I'm sorry, I'm having a senior moment, but it was the command office in the VA that could track all the cases in an emergency and gave them a unique ability, and actually Stone brought that back. We haven't had preparedness. FEMA, as we know, has actually not fulfilled VA requests. And one could, I mean, I don't know, argue that it's actually sabotaging the agency. And so I think, I mean, one of the things that I'm disturbed by is, for example, you watch Rachel Maddow, or there was CNN, and you have a lot of people talking about the VA who don't really know very much about it. For example, on Rachel Maddow and CNN, there was a report in which they confused the veterans home in Massachusetts and Holyoke that's having so much problems with the VA, as if the VA controlled the veterans home, which we, you ought to know if you're reporting on this, that state veterans homes are not controlled by the VA. They're state veterans home, and the problem in Holyoke was very different. I was disturbed the other day by Leo Shane's reporting that I usually like a lot, where he reported on VA-connected deaths from coronavirus as though VA killed, people as opposed to coronavirus. I think you have to be very careful about this, particularly in this environment. Obviously, there's been a lot of mistakes, but I think as Marilyn Park talked about on the chat, the fact that VA has been able to surge up in staffing shows that they can do it. They can also fix the cumbersome hiring processes. Congress can legislate that VA employees can get more money. The fact is that there's a way, but there's not a will. And we outline all the different ways, and a lot of people have ideas. But if your basic focus in Congress and in the administration is to privatize or slowly privatize the VA, then there's not going to be a lot of will. And I think now is the time to say to the American public, look, you may not have gotten the VA before. You may not have understood about the VA before. You may not know any veterans or even care about veterans, but the VA plays a central mission in American healthcare, not only in teaching and research and clinical care development, models of clinical care, but in its fourth mission. Coronavirus is not going to go away next week, as some sadly think is going to happen. There may be waves of it that we're going to face in the next 2 years. We need a strong VA to fulfill its fourth mission and all its missions, and we need Congress to reconsider the wisdom of privatization. That is the fundamental issue.
And I think that we're actually very lucky that the VA is more transparent than almost every other healthcare system in America. The question about VA deaths, or as Suzanne said it from Leo Shane's article, VA connected deaths, that doesn't often get asked of private healthcare systems. And I think it was on Kaiser Health News last week where they basically said, we'll never know the true impact on healthcare workers that COVID-19 has impacted, just because they're not required to report those things. I want to turn it over to Herbert Hoffman, who's been very patient with his hand up. Herbert, do you have a question for us?
Yes, I submitted a couple of questions on your form, and I pretty much can repeat them. Susan just made some reference to one of my questions, which was, what is going on in the VA in terms of the number of COVID patients and deaths? We don't know the answer to that, I gather. And beyond that, there's the issue of what's going on in the active military with regard to COVID. We don't know the answer to that. I think a cap was put on that information about 5-6 weeks ago. I think it was put on right after the aircraft carrier incident. And these are important issues. I'm going to just speak to the second issue, which is active military. There is going to be a very significant fallout from COVID with regard to the active military who are going to be infected or are infected. And I would throw in the veterans homes on top of that, because with COVID, the treatment, the ventilator treatment in particular, is very destructive to various parts of the anatomy. And these are people who are going to be seeking Veterans Administration medical services. And in addition, of course, we've got the emotional aspect, the trauma that many COVID patients will experience and have residual emotional and physical consequences. So if anybody has any answers or any clues to any of that, that'd be great.
Thank you, Herbert. Suzanne or Jasper?
Well, perhaps Jasper has something to add, but I think these are very good questions. And, I think that it gets to the active duty military is a real concern. And we saw the administration's response to the captain of the ship that, was essentially fired when he raised issues about COVID. You see the administrative's response every day. Mike Pence goes to Mayo Clinic and doesn't wear a mask and is allowed to enter the clinic by high-level administrators without wearing a mask. Today, or was it yesterday, Trump had a big celebration of nurses, VA nurses included, where a bunch of nurses from the American Nurses Association and a nurse practitioner organization stood shoulder to shoulder, no masks. This is clearly administration policy to force healthcare providers who should not be agreeing to this to kind of, downplay the dangers of togetherness and wearing no masks. And I think that there's going to be a huge impact on the VHA of COVID, not just now, but obviously, it's very important to say that veterans are at way higher risk for hospitalization and death from COVID, not because of the VA, but because of their military service, because they have so many underlying health conditions due to their military service. And we know that that increases the risk of hospitalization and death. I think a lot of veterans are going to be going to the VHA for healthcare because they have lost their jobs, they will have lost their healthcare, they will have lost their income. And we need a stronger VA, more staff to accommodate what I think will be a growing need. And Russell Lemley has pointed out, who is worked in the VA for many years and also is a colleague at VHPI, that this huge economic crisis are we going to be able to afford private health care, which is way more expensive for veterans?
And Ellen Milheiser's been posting in the comments some numbers out of the Pentagon today regarding military cases and death of COVID-19. And the VA is posting and tracking those numbers on its own website as well. I think that something that we've seen in the news just earlier this year before COVID-19 hit was a lot of the military medical corps services for active duty service members was almost going down the same path of VA privatization, where a lot of that care was being moved into the community and they were getting rid of a lot of military medical staff. That program has been put on pause now, thank goodness, because we need those folks treating members of the active armed forces. But that, again, just as an example of privatization. Jasper, did you have anything? And again, if anybody has any questions, please feel free to raise your hand and we'll get you on the horn here.
Yeah, I would just add that just to make clear that this is a crisis that will last a long time, and that, just yesterday a VA memo projected a spike, I think surge was the word they used, in long-term care resulting from veterans who contract the coronavirus. There can be long-term lung damage and sort of exacerbation of underlying conditions. So, to the point, an earlier question was around how long these new hires will be in place. Are these temporary hires for the crisis for the next 2 months, or are these actual full staff positions that will stay in the VA and continue helping out? Because the ramifications from this are enormous. Similarly, the VA's suicide crisis line has seen a huge spike in calls since the coronavirus took grip of the country. So, the veteran population will be massively impacted by this, mentally, in their physical health, and also in their economic health. I'm sure the GI Bill will see a huge spike in the next years, and there have been significant issues around bureaucratic sort of administration of the GI Bill, because the VBA, which is the Veterans Benefit Administration, is also understaffed and also sagging under, all of these benefits that they have to process and everything else. So, we need to keep this conversation going. We need to ensure that the staffing that is now happening continues and that these are permanent positions. I've asked the VA about these initiatives, how many folks have actually been hired, what the breakdown is between nurses, housekeepers, doctors, et cetera. And I haven't heard anything back. I hope to get more information soon, but it's difficult to tell what exactly these efforts are at the present moment.
Linda, you talked before about how understaffing has been less of a problem over the last couple of years after leadership started to listen to your members' concerns at your facility. Could you just talk a little bit about what the impact on understaffing has on employee morale? And since I think you probably have to jump off here in about 10 minutes, if you just tell us about the mood of some of the folks you represent and any veterans that you come in contact with at VA facilities lately.
Well, lately, to be honest, our staffing has been ramped up, and we're thankful for that. But in past years, when we, lack staffing, of course, the morale goes down because that ties into, the workload. You have more workload, so you have less people to do the work, and it's nothing. Managers sometimes still, of course, want those trinkets to be cranked out, even if you only got 10 and you need 20 people. So of course that, lessens the morality. And then as far as like your vacation or your just family life or everybody's stressed because of staffing. But now I can, say that we have gotten a better handle on it. And the nursing, I think, has ramped up the most. We do still have pockets in primary care where the providers, when they leave, their panels are, switched over to other doctors. And so that has still not really fully corrected itself, because we do have a lot of high turnover for our primary care providers. And I believe it's mainly because their panels are so heavy. But overall, I want to say that up until COVID came, we were getting there. And, unfortunately now we still now have to play catch up, especially if COVID is going to be here for a while. And to answer the question about, are these full-time positions? Well, I've seen some not to exceed 3 years in some appointments. So that is a good question and a good concern to bring up, because if these are temporary positions, then, what are we going to do in 2 years or 1 year down the road when we are back at square one? So that is a very good observation that you guys are making, and something that we definitely need to stay on top of. So.
Well, and also, how do you recruit people if you tell them, well, you're just, you're only here for 3 years? Or, this was the problem in Phoenix, which people neglected to mention in their reporting, which was that one of the big problems in these southern and, southwestern, western places where veteran snowbirds come, is that, you get in Phoenix, for example, they would have an influx for 4 months or 3 months of 25,000 patients. You can't hire. How do you staff up? You tell a nurse like Linda Ward Smith, a wonderful nurse, come for 4 months and then goodbye, come for 3 years, 2 years, 1 year and goodbye. I think that one of the things we talk about in our report is a solution, is that the VA calculates its budget. It's a complex, way it calculates the budget, but it calculates the budget in large part on prior year's utilization. And so if you don't reconsider how you calculate the budget, then you're essentially baking in staffing shortage into the subsequent year's budgets. Because if you had a clinic where you only had enough staff to accommodate 100 patients, but you really need, 400 or 300 or 200 needed care, that utilization doesn't reflect need or demand. And so you have to really reconsider how the budget is calculated. We talk about that quite a bit. That can be done. None of this is rocket science. Treating employees well, as Ken Kaiser says, is not rocket science. And as Marilyn says, if you can hire, or Teresa Morris says, if you can hire 9,000 people in 120 days, you can hire 55,000 people or more, you know, and we have the money to do this. I mean, we just haven't got the will. And I think that this COVID crisis really gives us an opportunity to say, you must develop a will as well as a way.
So Suzanne and Jasper, as we come up to the top of the hour, and again, if anybody wants to ask a question, please raise your hand and we'll get you on the mics. But Suzanne and Jasper, who needs the will to do this? You know, if Secretary Wilkie is doing this in an emergency situation, but has told Congress before that hiring is not his priority, you know, who needs to, I guess, make it happen?
Well, again, you know, we like to believe that if the Democrats replace Trump, you know, we'll be fine. But Joe Biden's veteran platform is all pro-mission. You know, the Democrats gave Trump the win, or an overwhelming win, on the Mission Act. They voted for the Accountability Act. There's other things in the hopper right now that are very disturbing that I know the HPI will have subsequent calls on, that increase privatization. We need to change the wisdom in Congress and the spine in Congress, and veteran service organizations, I think, need to mobilize their members more around these issues. And we need to have, you know, the support of everyone on this call. You know, people need to reach out. Veterans need to reach out, just as the union staff needs to reach out. And I'm an optimist, you know. I'm a pessimist of the intellect and an optimist of the will. And I think we can solve this problem, and we have a historic opportunity, because suddenly, you know, it's like people are suddenly, people are suddenly recognizing the value of nurses. They kind of were here for a long time, you know. And the VA, they're suddenly recognizing the VA. But I think one of the most important things for people on this call, people in the VSO community, people in the media, is and in Congress and anywhere, and you can do this when you get off the call, is stop the VA bashing. You know, I mean, you can constructively criticize, as we try to do, the VA, the VHA, the VA, the VBA. I mean, we certainly are not, you know, cheerleaders, and we don't say that everything that is done is right. But when you approach problems, you have to do it in a supportive and a constructive way, as opposed to this grandstanding and sensationalistic way. And that has to stop, because you cannot retain and recruit employees if you're going to tell them all the time that they're at fault, that they're terrible, and that they're, you know, these are people who are taking care of the most difficult patients in the country. Veterans, they have multiple problems. Many can be very cranky and not so easy to deal with, and they need more support while we're making improvements and correcting problems.
So everybody, you all are welcome to stay. We're going to keep talking. We still have some other questions coming in from folks, but if you're only able to stay with us an hour, thanks for joining us, and make sure that you stay tuned to veteranspolicy.org and our newsletter for more info. We did have a question, Suzanne and Jasper, about the ISP and that program. Why did it go away, especially if it was fulfilling a critical staffing need?
Do you want me to do it, Jasper?
Sure.
The ISP is just really a great example of the folly of decision-making in the highest echelons of the VA. The interim staffing program was a small program. I think it was 76 doctors, nurse practitioners, physician assistants, and they would serve as a kind of internal temp agency. They call it for physicians and healthcare non-nurses, they call it locum tenens agency. And basically, you know, somebody would retire, somebody would go on leave, somebody would go out and get sick, and they would have a VA provider go fill in on a temporary basis in that area. And essentially they cut the program. They replaced it with a telehealth program telehealth is fine, but for this kind of service that these ISP people performed. The people in the field loved it. We were given emails from chiefs and assistant chiefs of primary care testifying to how wonderful the system is. The private sector temp agencies charge more money. They give you people who don't necessarily know the VA. 31 providers wrote a letter to Robert Wilkie asking him to restore the program. They tried to go to some VSOs. They got some help from some, not from others. And, you know, this is a small program, but an important program. And it is both instrumentally and symbolically symbolic of the problem, where you have a very successful program that saved you money and then you get rid of it.
I'm going to skip Delano now, Suzanne.
Yeah, I just got a word to add. And again, it's, you know, I loved all the conversations. We've learned a lot, but, you know, I think it begs the question in many ways, and looking about how we as veterans and Americans can fight, you know, to save the VA, save VA healthcare. It's an institution that our whole country treasures. And I don't think it's a mystery in terms of we've got to lobby Congress, but the question is, how do we go about doing that? And certainly from my experience, I was with a group in February in Washington. We've lobbied 30-some members of Congress. But again, there needs to be so much more of this kind of activity going on. There are two groups, Vets for Peace and Common Defense, both progressive veterans organizations that are actively engaged in trying to work to save the VA. And we need to link up all of our, you know, fighters out there for the VA and figure out how we can do this campaign more and more effectively. Because it really is Democratic members of Congress, not Republicans, who are going to save the VA. And there are a whole number of them who voted against the Mission Act, some 70-some members of Congress. They are at least very identifiable members of Congress who could rally to our side. And as we head towards the election, the possibilities for us being able to pull them together and fight for veterans health care is a very real possibility. So I urge all of us on the call to link up to each other, link up to these organizations, and figure out ways we can fight together to save the VA.
Thank you, Skip. I'd like to go back to Herbert Hoffman. You've got another question, Herbert?
Yes, it's more a comment than a question. And it follows pretty much on what Skip just said. I think it is past time for all those employees who have been, as Suzanne said, pushed out of the VA, fired. There are many other similar instances in federal agencies across the country and in Washington. Somebody needs to pull these people together to create an active lobby and to have their voices heard in unison. This has not been done. We've been faulting people for not speaking out. Somehow, courage has to take its place.
Well, one of the things that I think, I mean, we didn't discuss it in this report, but one of the things that I think needs to be done immediately is to go to Senators Manchin and Rounds and get them to reinvigorate their bill to repeal the Asset and Infrastructure Review Commission that is set to be appointed by this president in 2020. And it is a commission that would look at all the VA facilities and decide whether to close them or strengthen them. And I think given this president's commitments, there's a danger that he will appoint people that want to close VAs. This would be a disaster now. There are estimates that 20 to 40% of American hospitals will be negatively impacted, potentially closed because of the hit they've taken because of the coronavirus. In rural America, there are literally there are very few mental health providers. There are very few primary care providers and so forth. We can't afford to lose anybody, any facility out there. And we've lost something like 110 rural hospitals in the last 10 years. And God knows how many we're going to lose because of COVID. And I think we need to get rid of that commission. That commission will make a list that has to be voted by Congress up or down. You can't pick and choose what you're going to close. And if they vote it down because they don't like the decisions made by the commission, it would have to be, I believe, and I may be wrong here, somebody on the call may have better information than I do. I believe that if they vote it down, it would have to be veto proof. And this is an immediate thing that we could do. Manchin and Rounds introduced this. I think it was a year ago. Jasper, do you have more information? And they haven't pushed it. And maybe Jasper, you might want to say something about it.
Yeah, sure. I'll put a link to the bill in the chat. And yeah, essentially what this would do is it would eliminate the commission Suzanne just spoke of, the Air Commission as it's called, which could potentially devastate rural regions in particular, who have relatively low usage numbers at VA hospitals. This is a bill that pretty much everybody agrees with in Washington, save the Republican Party. But as this bill was circulated, veterans groups were in support of it, and many Democratic lawmakers were in support of it. The reason that it has not moved anywhere is because many of the large veteran service organizations supported the Mission Act, and so did a number of many Democrats. And so they are now skittish to put their names on a bill that essentially admits tacitly that a previous bill they supported was flawed. This is sort of silly and ridiculous and sort of a classic Washington instance of sort of cowardice, but it is what has happened. So if folks are looking to put their pressure somewhere, I mean, it's or sort of get more involved with the future of the VA, this is an interesting bill to examine. And, you know, it's worth bringing up to Manchin and Rounds if it's something that you believe in.
So thanks, everybody. I think that is all the questions that we have today. Thank you, Suzanne and Jasper, for this report. We will be posting it on veteranspolicy.org over the weekend, and it'll be right in your inbox if you're subscribed to our Driving the Week newsletter. If you want to sign up, just go to our website, and there's a sign-up form right on the front. Again, thank you to Linda Ward-Smith from AFGE and a VA nurse, and Mark Foreman, who is a Vietnam veteran, and Isam, who was able to join us today and talk about his story. But thank you all for joining us for the Veterans Healthcare Policy Institute's discussion on the VA vacancy crisis. I'm Brett Copeland, our Executive Director, and if you have questions that come to you after you leave this meeting today, feel free to email me at execdirector@veteranspolicy.org. Thanks so much for joining us, and we hope to see you all again soon.